to nursing may be able to provide the care that our clients need in maintaining their quality of life and being instrumental in birthing them to external life. This simply means that we as nurses should be able to provide the care that our clients need in both life and death. Generally, we believe that valuing people should not only happen when they are alive and healthy, but also in their dying days. We as nurses who render end-of-life care should be spiritually and emotionally ready. It also reminds us of what our mission as nurses, which is to care for our patient from birth to death, that we should give the patient the dignity that he or she fully deserves. Good day everyone, I am Mariah Alasihaw and we will be discussing about the Carmencita M's Abaquin Prepare Me Theory, the intervention and quality of life advanced progressive for cancer patient. To begin, let's have first the basic information about Carmencita M. Abaquin. So who is Carmencita M. Abaquin? She was a nurse who graduated from University of the Philippines College of Nursing with a master's degree in nursing. She was an expert in medical surgical nursing with subspecialty in oncology in nursing, which made her known both here in the Philippines and abroad. She also served the University of the Philippines College of Nursing as faculty and held the position as secretary of the College of Nursing. Her latest appointment as chairman of Board of Nursing speaks for her competence and integrity in the field she has chosen. Let's move on to the basic assumption and concept of Prepare Me Holistic Nursing Intervention. The nursing intervention provided to address the multidimensional problems of cancer patient that can be given in any setting where patient choose to be confined. The emphasis of this program is on providing nursing care holistically. In more simple terms, Abaquin preparation focuses on the problems that cancer patients often experience. Additionally, Abaquin Prepare Me Theory implies a type of nursing care or holistic nursing approach that deals on how to care for cancer patient and improve the quality of life of patient with cancer and other chronic disease or terminal illnesses. And now, let's talk about the 5 components of Prepare Me Theory, mainly presence, reminiscence therapy, prayer or relaxation breathing, meditation, and values clarification. So let's talk about the presence. Presence is being with another person during the times of need. This includes therapeutic communication, active listening, and touch. For example, may breast cancer ang patient, so as nurse, ikaw ang taong magtatanong kung ano ang nararamdaman ng patient. You can say na i-rate ng patient from 1 to 10 ang nararamdaman niya when it comes to pain. So basically, nagkakaroon ng communication ang nurse to patient. As nurse, we intend to listen about how they feel and so on. The next is reminiscence therapy. This therapy recall of past experiences, feelings, and thoughts to facilitate adaptation to present circumstances. In this therapy, the nurse let the patient share their life before they had the illness. So here, the patient share their hobbies or what they felt during those times. This concept provides the patient the sense of fulfillment and comfort. Then we have prayer or relaxation breathing. It is a technique to encourage and elicit relaxation for the purpose of decreasing undesirable signs and symptoms such as pain, muscle tension, and anxiety. The next is meditation. It encourages an illicit form of relaxation for the purpose of altering patient's level of awareness by focusing on an image or thought to facilitate inner sight, which helps to establish connection and relationship with God. It may be done through the use of music and other relaxation techniques. This concept greatly helps cancer patients to lessen anxiety, depression, and pain that they have been suffering. Also, meditation improve the quality of sleep and mood. Lastly, the nurse must help make a supportive environment for the patient and his family in his dying days. An environment like this would promote dignity in his days left, thus helping the patient accept his fate and help him or her be ready for the afterlife. The family is also guided in this rough time, addressing their grieving process by instilling in them that death is part of life. So let's examine the meaning of the theory. The first one is terminally ill patients, especially cancer patients, require holistic approach of nursing in different aspects of man, namely emotional, psychological, social, and spiritual. In this premise, patients with incurable disease require multidimensional nursing care to improve quality of life. Number 2, prepare me nursing intervention are effective in improving quality of life in terminally ill patients. The next is utilization of intervention as basic part of care given to cancer patients. Likewise, incorporation in the basic nursing curriculum, the care of these patients. Prepare Me must be introduced and focused during training of nurse both in academe and practice. Then, develop of training programs for care provider as well as healthcare profession where intervention is part of treatment modalities. Additionally, the nurse must be honest about the feedback on his or her condition. Nurses must do this so that they would know what the expectation of the patient and the family so that they may render a holistic caring style for the patient together with his family in his dying days. This would help the patient and family address the needs of the patient in any manner as possible, including emotional, physical, and spiritual. Lastly, the nurse must help make a supportive environment for the patient and his family in his dying days. An environment like this would promote dignity in his days left, thus helping the patient accept his fate and help him or her be ready for the afterlife. The family is also guided in this rough time, addressing their grieving process by instilling in them that death is part of life. Talking about the logical adequacy, the conceptual framework is logical because it is parallel with her definition of nursing and it works for the goal which is quality of life. She didn't give emphasis on the extraneous variables affecting the variables involved. And now, we will be talking about the strength and weaknesses of the prepare me theory. So, let's talk about the weakness and limitation. The weaknesses and limitation of this theory includes caring ideals of nurse, severe depression of the patient, more time is needed to make the patient interested in prepare me interventions because they are already experiencing loss of interest in things. On the other hand, talking about the situation in the Philippines, understaffing in the Philippine hospital is prevalent. In the Philippine setting, due to understaffing and financial constraint, time for bedside care is limited. So the strength of the prepare me theory is provides us in standardized and holistic approach in addressing the needs of terminally ill cancer patients, and it can also be used for another terminal cases. So let's talk about the usefulness of the theory. This theory is useful in addressing the needs of terminally ill cancer patients. This encompasses different aspects including family relationship and self-actualization. It is also appreciate the impact of relatives' cancer and offering guidance and support via patient-centered counseling and that can enhance the quality of care. And that's the end of my presentation. I am now ready for the questions, suggestions, and recommendations. Thank you.